Hey everybody, Dr. Dan here. Just wanted to shoot a quick video and talk to you guys about the primary ways that we break people's care down into what we call different phases of care, okay? Now, obviously, our goal for everybody is that they eventually transition into what we call like lifetime wellness or lifetime maintenance type care. With obviously the goal of that type of care to be, that they help to maintain all of the good results that they got from their care in the beginning and they don't start to slide backwards, okay? But 9 out of 10 times, we can't start somebody in lifetime wellness or lifetime maintenance care. They're coming to us in some sort of need or some sort of crisis where their health is beginning to fail them, okay? And so we need to take them through a process in order to get them to that lifetime care. And that's what we wanted to talk to you about today, and talk to you about the importance of why it's vital that you follow these steps in order to achieve the highest quality of life and then be able to maintain it on the long haul, okay? So the initial phase of care for most people whenever they come into the office is what we call the corrective or the acute phase of care, okay? That's when people are coming to us with their big overall problems, the things that drove them into the office, okay? The first step in that care is to, number one, determine if they're even a candidate for chiropractic care. Is what they're dealing with or their quality of life, the way that their health is failing, is it at all related to what we do in the office? If the answer to that is yes, then we set them up in their initial phase of care. During that phase of care, we try to be very, very consistent, usually multiple visits in 1 week. And we do that for a period of 30 to 60 days, maybe a little bit longer, maybe a little bit less. It's gonna be a little different for everybody, okay? But the idea behind this care is to be incredibly consistent so that we can break patterns, we can start the healing process, we can start getting the adjustments, doing what we call holding in place. So essentially, retraining the body to hold these bones into a more normal position, alleviating the pressure on the nerves and allowing the body to heal up. During that initial phase of care, you also typically begin to see that your quality of life is improving and you're starting to change, and the things that initially drew you into the office are starting to get better, okay? Might not be 100%, this is a process, but we at least are seeing that the adjustments are holding and that your quality of life is beginning to improve. As those things line up, then we begin to reduce the care. We drop you into what we have dubbed stabilization care. That care is less frequent, but certainly frequently enough that we're continuing to support your body through the healing process, support you as your quality of life heals, and most importantly, as your adjustments begin to hold for longer and longer periods of time, okay? And then at some point, typically in the, 30-day to 6-month time period, and I know that that's a big variance, but everybody's different. But normally somewhere in there, we're going to have a conversation and we're going to say, hey, you know what? Life is pretty good. Quality of life is back to where I want it to be, or darn close. And your adjustments are holding for long periods of time. You're doing very well in between your visits. And then we start having the conversation of transitioning into more like lifetime or maintenance care, okay? That lifetime care is, again, it's gonna be different for everybody, okay? I will tell you this though, that most people come into the office, once they've achieved their health goals, they've achieved the things that they wanna do, they come into the office somewhere between 1 and 4 visits per month, and that's what they adopt as their long-term lifetime care, okay? It's not that dissimilar to any other good habit that you have. If you get yourself to where you want to be from, like, let's say a physical activity or a physical physique standpoint, you worked out for 6 months, you dieted, you did everything you could, you got to your ideal weight, and then you ignore that, what's going to happen? You're going to start sliding backwards. Same thing with your dental health. If you do the work to get your teeth healthy and then you ignore that health for the next 2 or 3 years, what's going to happen? It's going to slide backwards. This is absolutely no different than that, okay? So once you get to where you want to be, we just want to help you maintain it so that your body does not start to slide backwards. So I hope that helps. I hope that helps you understand the importance of following these different phases of care to get you to that lifetime wellness, that lifetime maintenance. We love you guys. Thanks.